Hey there, I'm Dr. Bill Tortoriello, your local DNS Pediatric Practitioner. If you want some useful, practical advice on how to handle your newborns, please stick around. Now, based on what we talked about in the previous video, we fundamentally want to give our newborns as much external support and stability as possible. This means that primarily controlling their head and neck, whether or not we're lifting them up and down from the table or just simply holding them in positions like when feeding. Providing head and neck control gives them the support and stability to feel as comfortable as possible in all positions. Now, in terms of positioning, DNS will recommend a variety of positions used throughout the day, from lying on their backs to putting them into tummy time on their bellies or even placing them on their sides. They're all recommended. Now, we understand that a lot of babies are not going to tolerate these positions for too long. So we'd recommend in the matter of an hour, about half of the hour is spent on their backs. Another 10 to 15 minutes is spent on their bellies, and then another 10 to 15 minutes are combined side to side. This is a typical format. We also understand not all babies are going to like these positions, and they're going to show you just how much they don't like these positions by crying. What we want you to understand is that this does not mean your baby's in pain or that they're hurting. It just means they're frustrated with a new position that they don't understand yet. But I guarantee you, with more time spent in each position, the crying will slow down and ultimately cease. This is typical for ideal and normal development of your newborn. Finally, in the same way we want to provide our newborns with as much mechanical support and stability as possible, we also don't want to overstimulate our newborn senses. So just for some practical advice, no harsh lighting like found in an iPad or an HD television screen. Try not to scream or yell in front of the child because it'll create a startle in the child. We also don't want to quickly move positions or change positions of our newborns. Nice, gentle, slow movements. This is all relatively common sense, but I think it's worth emphasizing. At this point in development, all our newborns need is mom and dad's voice, some soft lighting, and a little security from the environment, and their development's going to be just fine. All right, I'm Dr. Bill Tortoriello, and thank you for your time and consideration today. If you like what you heard, subscribe to the channel, hit the like button. If you have any particular comments, feel free to comment down below. Otherwise, I'll see you next time.